Hi everyone, this is Anatomy and Physiology video for healthcare students. In this video, we're talking through blood typing with unknowns. If you're interested in learning more about blood types, ABO, and RH, there is a separate video that walks you through antigens, antibodies, agglutination, and blood type compatibility for transfusion. To set the stage for understanding how we do blood typing with unknowns, let's go and talk about a topic of agglutination for just a moment. So agglutination occurs when our antibodies generated by our immune system bind foreign antigens. So those foreign antigens may be on someone else's blood if we're getting a transfusion. So antibodies are specific, they are built to bind a particular antigen. Just like in this case here, we have an anti-B antibody built to bind a B antigen. So if blood types would agglutinate one another, like if we give A to B, for instance, we would consider those to be incompatible blood types. So agglutination is the end result if you mix those foreign blood types together that have incompatible antigens and antibodies. So let me illustrate how agglutination works. I'm going to say that my blood type is A. Let's not worry about Rh factor right now. Let's just simply keep it simple with just the A antigen. Let's say I need a transfusion. I get blood type B. So I've got this B antigen in my bloodstream, and my blood carries an anti-B antibody. Those anti-B antibodies are shaped like the letter Y. They can bind foreign antigens, which in this case happens to be that B antigen. And that is a problem because now we've got this agglutination occurring. We're going to use this as the basis for helping us determine blood types of unknowns. If I am type A, I know that I'm going to carry an anti-B antibody. Okay, so we're going to use the basis here to step forward with some unknowns. So here's how this works. If you go in and say, okay, I don't know my blood type, can you figure it out for me? They can take a blood sample, they can prick your finger, they can grab a drop of blood, they'll drop it into a little well on a slide, and then they take an eyedropper, and this dropper contains antibodies. Let's see if your blood contains antigen A. Okay, so how do we figure out if you have antigen A? What do we have to do? Well, should we give you a drop of antibodies for the A antigen, for the B antigen, or for the Rh antigen? Which one is going to reveal that for us? Let's use a dropper that contains antibodies against antigen A. Why? Because if they are present, your blood will be agglutinated by that antigen, or sorry, that antibody. So let's take that dropper, let's place some antibody for antigen A on that blood. Now, if nothing happens, then you don't have the antigen in your bloodstream. The antibody had nothing to fight. Let's do this with another sample. Let's say we've got another sample to do. We've got a blood drop here. We've put it on a little well, and we're going to take this eyedropper that contains, again, antibody for the A antigen or fighting that A antigen. We're going to place it on that unknown, but this time agglutination occurs. So if the anti-A antibody agglutinates a blood type, what does that tell us about the presence or the absence of antigen A? Well, that must mean you've got it, right? The anti-A antibody found something to fight. It fights the A antigen and it agglutinates it. So notice the change in the color here. That's going to show up when you're fighting a foreign antigen. Let's do this for B. So let's take another blood sample. Let's drop it into a little well. And now we're going to use an eyedropper that is full of anti-B antibody. We're going to drop it on that unknown sample, and we're going to wait and see if anything happens. Hey, if nothing happens, you do not have the B antigen. That means the anti-B antibody didn't find anything to fight. So no reaction, no agglutination. Now, let's take another blood sample. Let's do it this time. There comes that drop of blood. Let's put on there the anti-B antibody. And this time we had a change. So this time we found that there was agglutination. That means the anti-B antibody found some B antigens, agglutination occurs. That confirms for us this blood here has the B antigen. Let's do it for RH. So again, let's take a drop of someone's blood. Let's place it in this well. And let's fill a dropper full of anti-RH antibodies. I'm hopeful that the routine is becoming familiar because if we drop that anti-RH antibody on this unknown blood, if nothing happens, that means we don't contain the RH antigen on our blood. No agglutination means we don't have it. It is as simple as no reaction means it's not your blood type, versus if there is a reaction, it means it is part of your blood type. So here, let's take that foreign blood. We don't know what it is. It's somebody's sample. Let's drop that anti-RH antibody on that unknown blood sample. This time there is a reaction. If there's a reaction, you have the RH factor. So agglutination means you've got it. So in doing this with all three, it is as simple as if there's agglutination, that's your antigen. If there's no agglutination, it means you don't have that antigen as part of your blood type. So let's walk through this one. Notice that A is agglutinated. Letter B, no agglutination. RH, no agglutination. Since A agglutinated, that's antigen A, and you don't have the RH factor, so you're A negative. This blood type is A negative. Let's do another one. All right, it is as simple as what you see is what you get. You have antibody A placed on the A plate, agglutination occurred. You have an antibody against B placed on the B plate, agglutination occurred. So you know you've got AB blood. Now the catch is, do I have RH? So it doesn't look like that one's agglutinated. So are you RH positive or are you RH negative? No agglutination, you're negative. So this blood type is AB negative. Let's do another one. This one has no agglutination. There was no agglutination for A, B, or RH. So what are we? This one is blood type O negative. No agglutination for any of these, including the RH factor. This one's a pretty straightforward one, O negative. All right, give you a moment to look at this one. Notice that B has agglutinated, so has RH. Remember, it's what you see, it's what you get. If agglutination occurs, that's your blood type. You are B positive. All right, let's do this one. So here you've got agglutination only for the RH factor. You do not have the A nor the B antigen. So in this case, what is your blood type? Yep, you are O positive. So this is how it really looks. You'll notice on the left and the right, looking at the well that says anti-A, those are agglutinated red blood cells. And looking at the far right, the well that says anti-D, that's RH. And that one's agglutinated. That means this person has what blood type? This one would be A positive. B had no agglutination, so B is not part of our blood type. It would be A positive. And just to show you a couple of others, for instance, the one that's outlined in a white square near the bottom that says ABO, you'll notice that those three didn't have a reaction. So depending on how this is done, the reaction may look like the blood has clumped a little bit or clotted up, but it's not clotting, it's agglutinating. That's because the antibodies can bind antigens. So that's what we're looking for to distinguish if we've got a reaction or not. I hope this video was helpful for you. If you have any questions, please leave them in the comments for me. And if you liked the video, please follow my channel. Thanks for watching.